Question 1. A patient complains of a burning sensation on their palate immediately after a bite-wing series. Upon inspection, the dentist observes an erythematic, retinitis, area matching the shape of the intraoral receptor. Which of the following is the most likely cause of this patient's complaint? A. Underexposure of the receptor causing increased processing time. B. Excessive kVp setting leading to higher energy photons. C. Overangulation of the PID resulting in the central ray missing the receptor. D. Overheating of the X-ray tube head during prolonged or consecutive exposures. Answer: D. Overheating of the X-ray tube head during prolonged or consecutive exposures. This question tests understanding of potential equipment-related patient injury. The key clues are the burning sensation, erythematic area, and its match to the receptor shape. This strongly suggests a thermal burn from an overheated X-ray tube head or PID, position indicating device, contacting the patient's oral tissues, which can occur with prolonged use or insufficient cooling time between exposures. While other settings affect image quality or dose, overheating is a direct physical cause of burns if the tube head contacts the patient. Always allow the X-ray unit to cool down between exposures, especially during a full mouth series, to prevent patient discomfort or injury. Question 2. When converting from D-speed film to F-speed film, which adjustment to the exposure settings is typically recommended to maintain optimal image density while reducing patient radiation dose? A. Increase mA, milliamperage, only. B. Decrease exposure time only. C. Increase kVp, kilovoltage peak, only. D. Decrease both mA and kVp proportionally. Answer: B. Decrease exposure time only. This question assesses knowledge of film speed and its direct relationship with radiation exposure. F-speed film, also known as insight film, is a faster film, meaning it requires less radiation, and thus less exposure time, to produce an image of equivalent density compared to D-speed film. The keyword converting from D-speed to F-speed directly indicates the change in film sensitivity. Therefore, to maintain image density and reduce patient dose, the exposure time must be decreased. Think of it like this: a faster film needs less light to see the image, so you don't need to keep the X-ray beam on for as long. Question 3. A radiographic image appears significantly darker than desired, with very high contrast and very little differentiation between shades of gray. The most probable technical error leading to this outcome is: A. Insufficient kilovoltage peak, kVp. B. Excessive milliamperage, mA. C. Prolonged exposure time. D. Underprocessing of the film. Answer: C. Prolonged exposure time. This question tests the understanding of exposure factors and their impact on image density and contrast. A significantly darker image with high contrast and little differentiation between shades of gray is characteristic of an overexposed image. Both milliamperage, mA, and exposure time directly affect the quantity of X-rays produced, which in turn controls the overall density, darkness, of the radiograph. Prolonged exposure time directly leads to an excessive number of X-ray photons reaching the sensor or film, resulting in a very dark image. Think of overexposure as taking a photo with too much light, everything looks too bright, or, in radiography, too dark because the film or sensor absorbed too much radiation. Question 4. Which of the following is the primary purpose of adding aluminum filtration to the X-ray beam? A. To increase the penetrating power of the X-ray beam. B. To reduce scattered radiation at the patient's skin surface. C. To absorb long wavelength, low-energy X-rays that do not contribute to image formation. D. To narrow the diameter of the X-ray beam, thereby reducing the field size. Answer C. To absorb long wavelength, low-energy X-rays that do not contribute to image formation. This question focuses on the function of filtration in dental radiography. Aluminum filtration acts as a selective absorber, removing the soft or low-energy X-ray photons that would otherwise be absorbed by the patient's superficial tissues without reaching the film or sensor to contribute to image formation. These low-energy X-rays increase patient dose unnecessarily. The primary purpose is to remove these harmful, non-diagnostic photons, effectively hardening the beam and reducing patient exposure without compromising image quality. Imagine a sieve allowing only the strong, useful X-rays through to do their job, while holding back the weak ones that only cause harm. Question 5. The paralleling technique is considered superior to the bisecting angle technique for reducing geometric distortion. This is primarily due to which principle? A. The X-ray beam is perpendicular to the long axis of the tooth. B. The receptor is placed parallel to the long axis of the tooth. C. The X-ray source-to-object distance is maximized. D. The object-to-receptor distance is minimized. Answer B. The receptor is placed parallel to the long axis of the tooth. This question assesses a fundamental principle of radiographic technique. The key to the paralleling technique's superiority in minimizing distortion lies in the parallel relationship between the receptor, film or sensor, and the long axis of the tooth. When the X-ray beam is also directed perpendicular to both the tooth and the receptor, it ensures that the image recorded on the receptor is an accurate, non-distorted representation of the tooth's actual size and shape. While a longer source-to-object distance helps with parallelism and reducing magnification, the parallel placement of the receptor to the tooth is the defining characteristic that directly addresses geometric distortion. Think of it like this: if you cast a shadow onto a wall that is perfectly parallel to the object, the shadow will accurately represent the object's shape. Question 6. A dental assistant notices that a new box of radiographic film has an expiration date that has passed. What is the most likely impact if this expired film is used for patient radiographs? A. The images will appear excessively dark and difficult to interpret. B. The film will be more sensitive to light, leading to fogging. C. The images will exhibit a loss of contrast and reduced detail. D. The film emulsion will be too stiff, making it difficult to place in the patient's mouth. Answer C. The images will exhibit a loss of contrast and reduced detail. This question tests knowledge of film storage and its impact on image quality. Expired radiographic film degrades over time, primarily leading to a loss of emulsion sensitivity and increased latent image instability. This degradation manifests as a reduction in contrast and overall detail, making diagnostic interpretation more challenging. The most likely impact for expired film is a flat, dull appearance rather than being overly dark, which is often overexposure, or simply fogged, which can be from light leaks or radiation. Using fresh film ensures optimal image quality, which is crucial for accurate diagnosis. Question 7. A patient presents with a deep carious lesion on the mesial aspect of tooth number 19. Which intraoral projection is most suitable for detecting the precise depth and extent of this lesion, especially in relation to the pulp chamber? A. Periapical radiograph of tooth number 19. B. Horizontal bite wing radiograph including tooth number 19. C. Vertical bite wing radiograph including tooth number 19. D. Occlusal radiograph of the mandibular left quadrant. Answer A. Periapical radiograph of tooth number 19. This question assesses the appropriate radiographic projection for specific diagnostic needs. The keyword precise depth and extent especially in relation to the pulp chamber, indicates a need for a clear, undistorted view of the entire tooth, including the crown and apex, and surrounding bone. While bite wings are excellent for interproximal caries detection and crestal bone levels, they do not show the full extent of the root or relationship to the pulp chamber as clearly as a periapical radiograph. The periapical view provides a comprehensive image of the tooth's entire structure, making it ideal for evaluating deep lesions. Always select the projection that gives the most complete diagnostic information for the specific pathology. Question 8. In digital radiography, what is the primary advantage of using a charge-coupled device, CD, or complementary metal oxide semiconductor, CMOS, sensor over traditional film? A. Reduced image magnification due to smaller pixel size. B. Elimination of the need for infection control barriers. C. Instantaneous image display and reduced radiation exposure. D. Enhanced penetration of hard tissues with lower kVp settings. Answer: C. Instantaneous image display and reduced radiation exposure. This question focuses on the core benefits of digital radiography over film. The primary advantage of digital sensors, CCD or CMOS, includes two major points: the immediate availability of the image on a monitor, which saves time and improves workflow, and significantly reduced patient radiation exposure because digital sensors are much more sensitive than film. Digital sensors can capture an image with up to 50 to 90% less radiation than D-speed film, which is a major benefit for patient safety. While pixel size affects resolution, and infection control is still necessary, instantaneous display and dose reduction are the most impactful advantages. Question 9. What is the maximum permissible dose, MD, for an occupationally exposed dental professional over the course of a year? A. 0, 5 SV, 50 rem. B. 50 MSV, 5 rem. C. 5 MSV, 0, 5 rem. D. 1 MSV, 0, 1 rem. Answer: B. 50 MSV, 5 rem. This question tests knowledge of radiation safety regulations and occupational dose limits. The maximum permissible dose, MD, for occupationally exposed individuals, such as dental professionals working with X-rays, is set at 50 MSV, millisieverts, or 5 rem, Röntgen equivalent man, per year. This limit is established to minimize the risk of stochastic effects, like cancer, and prevent non-stochastic effects, like skin burns. It's crucial for dental personnel to be aware of these limits and practice ALARA, as low as reasonably achievable, principles to ensure their own safety and that of their patients. Question 10. When taking a periapical radiograph of the maxillary molars using the paralleling technique, which anatomical structure is most commonly superimposed over the apices if the horizontal angulation is incorrect? A. Zygomatic process of the maxilla. B. Maxillary tuberosity. C. Coronoid process of the mandible. D. Nasal fossa. Answer: C. Coronoid process of the mandible. This question tests a common error in maxillary molar periapical radiography. The keyword horizontal angulation is incorrect and maxillary molars is crucial. If the horizontal angulation is aimed too far distally, posteriorly, or if the patient's mouth is not open wide enough, the coronoid process of the mandible can be projected over the apices of the maxillary molars. This occurs because the coronoid process, a bony projection of the mandible, moves anteriorly as the patient opens their mouth. Misangulation or insufficient opening can cause its superimposition. The zygomatic process is also a common superimposition but is often related to vertical angulation or general placement, while the coronoid process is more specifically linked to horizontal angulation errors in this area. Question 11. A dental office uses a panoramic X-ray unit. Which of the following quality assurance tests should be performed to ensure the focal trough is correctly aligned? A. Sensitometry and densitometry. B. Step wedge radiography. C. Screen film contact test. D. Evaluation of a phantom image with specific markers. Answer, D. Evaluation of a phantom image with specific markers. This question targets quality assurance specific to panoramic radiography. The focal trough is a critical concept for panoramics, representing the zone of sharpness where anatomical structures are best imaged. To ensure this trough is correctly aligned and functioning, a specific phantom, a test object designed to simulate patient anatomy, with markers is used. Radiographing this phantom allows for evaluation of image sharpness and distortion within the focal trough, indicating if the unit is accurately capturing structures in the intended zone. Other options like sensitometry and step wedge are for film processing consistency, and screen film contact is for extraoral film cassettes, not focal trough assessment. Question 12. During a periapical exposure using the paralleling technique, the image appears elongated. Which of the following errors in technique is the most probable cause? A. Excessive vertical angulation. B. Insufficient vertical angulation. C. Incorrect horizontal angulation. D. Inadequate object-receptor distance. Answer, B. Insufficient vertical angulation. This question tests understanding of vertical angulation errors and their specific radiographic effects. An elongated image, where the teeth appear stretched and longer than actual size, is a classic result of insufficient, too flat, vertical angulation. The X-ray beam is not directed perpendicular enough to the imaginary bisector plane of the tooth and receptor. Conversely, excessive, too steep, vertical angulation causes foreshortening. Remembering these two specific distortion types and their causes is fundamental for correcting technique. Question 13. Which concept states that all radiation exposure should be kept as low as reasonably achievable? A. Inverse square law. B. Maximum permissible dose, MD. C. ALARA principle. D. Rectangular collimation rule. Answer, C. ALARA principle. This question directly asks for the name of a fundamental radiation safety principle. The acronym ALARA stands for as low as reasonably achievable and is the guiding principle for radiation protection in dentistry. It emphasizes the continuous effort to minimize patient and operator exposure to radiation without compromising the diagnostic quality of the radiographs. This principle drives the use of lead aprons, thyroid collars, faster films/digital sensors, collimation, and proper technique. It is a proactive approach to radiation safety, not just staying within limits. Question 14. A radiograph of the mandibular premolar region shows a radiolucent, dark, area below the apices of the teeth that appears to extend from the mental foramen. The patient reports no pain or swelling. What is the most likely interpretation of this finding? A. Periapical abscess. B. Mental foramen, a normal anatomical landmark. C. Radicular cyst. D. Pericoronal radiolucency. Answer, B. Mental foramen, a normal anatomical landmark. This question tests the ability to differentiate between normal anatomy and pathology, which is crucial for diagnostic interpretation. The keyword radiolucent area below the apices, mandibular premolar region, and no pain or swelling strongly suggest the mental foramen. The mental foramen is a normal anatomical opening on the external surface of the mandible, typically located near the apices of the mandibular premolars, and it often appears as a well-defined radiolucency. It's a common area for misdiagnosis, so recognizing it as normal anatomy is very important to avoid unnecessary treatment. Question 15. The purpose of the lead foil sheet found in the back of intraoral film packets is to A. Absorb scattered radiation and reduce film fog. B. Enhance the sharpness of the radiographic image. C. Increase the overall density of the radiograph. D. Act as a protective barrier against external light. Answer. A. Absorb scattered radiation and reduce film fog. This question targets the specific function of an often overlooked component of film packets. The lead foil sheet, placed behind the film, serves primarily to absorb remnant X-ray photons that have passed through the film. This prevents backscatter radiation, which can contribute to film fogging and reduce image quality. Additionally, it helps to shield the film from secondary radiation, further improving image clarity. It acts like a mini shield to keep your images crisp by reducing unwanted scatter. Question 16. What is the minimum distance an operator should stand from the X-ray tube head and the patient during an exposure without a protective barrier? A. 3 feet, 9 meters. B. 6 feet, 8 meters. C. 9 feet, 7 meters. D. 12 feet, 6 meters. Answer. B. 6 feet, 8 meters. This question asks about a fundamental radiation safety rule for operator protection. The inverse square law dictates that radiation intensity decreases rapidly with distance. To minimize exposure, an operator should stand at least 6 feet, approximately 8 meters, away from the X-ray tube head and the patient during an exposure if no protective barrier is available. This distance is considered a safe zone where the radiation dose is significantly reduced, helping to adhere to the ALARA principle for staff. Question 17. Which of the following would be the most effective method for reducing the patient's exposure to radiation when taking a full mouth series? A. Using a higher kVp setting. B. Increasing the source-to-film distance. C. Utilizing a rectangular collimator. D. Decreasing the MA setting. Answer. C. Utilizing a rectangular collimator. This question focuses on the most impactful methods for patient dose reduction. While higher kVp and increased source-to-film distance, within limits, can reduce dose to some extent, and decreasing MA reduces the quantity of X-rays, the most effective method listed for reducing patient exposure is utilizing a rectangular collimator. A rectangular collimator significantly restricts the size of the X-ray beam to just slightly larger than the intraoral receptor, reducing the exposed tissue area by up to 60 to 70% compared to a round collimator. This directly minimizes the volume of tissue irradiated, which is a key component of the ALARA principle. Question 18. A patient is undergoing radiation therapy for oral cancer. What would be the most critical consideration when performing necessary dental radiographs for this patient? A. Increasing exposure time to compensate for tissue changes. B. Avoiding any radiographic exposure due to increased sensitivity. C. Consulting with the patient's oncologist regarding the necessity and specific protocol for dental radiographs. D. Using only extraoral projections to minimize discomfort. Answer. C. Consulting with the patient's oncologist regarding the necessity and specific protocol for dental radiographs. This question delves into a complex clinical scenario involving a high-risk patient. A patient receiving radiation therapy for oral cancer is highly vulnerable to additional radiation exposure, and their tissues are already compromised. Therefore, the most critical consideration is always to prioritize patient safety and collaborate with the treating medical specialist. Consulting with the oncologist ensures that any dental radiographs are absolutely necessary and performed under the safest possible conditions, potentially with adjusted parameters or specific precautions based on their current treatment plan. This demonstrates interdisciplinary care and ethical responsibility. Question 19. If a radiograph appears clear or completely unexposed after processing, but the X-ray unit's timer clicked and the machine made a sound, what is the most likely cause? A. The film was placed in the fixer before the developer. B. The X-ray tube experienced a filament failure. C. The automatic processor's developer solution was depleted. D. The power switch for the X-ray unit was not turned on. Answer: D. The power switch for the X-ray unit was not turned on. This question asks to diagnose a common radiographic error, focusing on a completely unexposed image despite the unit appearing to operate. If the timer clicked and the machine made a sound, it indicates the exposure button was pressed, and the unit cycled, but no X-rays were actually produced if the power was off. A clear film means no radiation reached it to create an image. Placing film in fixer first would result in a clear film, but the question implies the issue is before processing, with the X-ray exposure itself. A filament failure would also result in no X-rays, but typically the machine wouldn't even click or sound like an exposure unless the exposure button was pressed, and then it would still indicate an error. If the developer was depleted, the film would appear white/light, not completely clear. The developer creates the image, fixer makes it permanent. The simplest and most likely explanation for a clear film when the exposure button was pressed is that the main power to the X-ray unit was off, meaning no X-rays were generated. Question 20. When utilizing a digital sensor for intraoral radiography, which of the following practices is essential for maintaining proper infection control? A. Autoclaving the digital sensor between patients. B. Wiping the sensor with a glutaraldehyde solution after each use. C. Placing a disposable barrier sleeve over the sensor for each patient. D. Immersing the sensor in an ultrasonic cleaner to remove debris. Answer: C. Placing a disposable barrier sleeve over the sensor for each patient. This question tests knowledge of infection control protocol specifically for digital intraoral sensors. Digital sensors are delicate electronic devices that cannot be heat sterilized, autoclaved, or immersed in harsh chemical solutions like glutaraldehyde, nor are they designed for ultrasonic cleaning. Therefore, the essential practice for infection control is to place a disposable plastic barrier sleeve over the sensor for each patient. This barrier prevents direct contact between the patient's oral fluids and the sensor, and the sleeve is then discarded after use, effectively preventing cross-contamination. Question 21. The period of time between exposure to radiation and the appearance of clinical signs is known as the A. Recovery period. B. Latent period. C. Accumulation period. D. Critical period. Answer: B. Latent period. This question defines a key concept in radiation biology. The latent period refers specifically to the time delay between the initial exposure to radiation and the manifestation of observable clinical signs or symptoms. This period can vary from hours to years, depending on the dose and type of radiation exposure. Understanding the latent period is important because the effects of radiation are not always immediate, making long-term monitoring crucial. Question 22. Which of the following conditions would require an increase in exposure time or milliamperage, mA, for a diagnostic radiograph? A. Patient with severe periodontitis leading to significant bone loss. B. Edentulous patient with generalized alveolar bone atrophy. C. Patient with very dense cortical bone or tori. D. Child patient with developing dentition. Answer: C. Patient with very dense cortical bone or tori. This question tests the understanding of how patient anatomical factors influence exposure settings. The keyword increase in exposure time or milliamperage implies a need for more X-ray photons to penetrate denser tissue to achieve optimal image density. Very dense cortical bone or tori presents a greater barrier to X-ray penetration than normal bone. Conditions like periodontitis with bone loss, an edentulous patient with atrophy, or a child with developing dentition would typically require decreased exposure due to less dense or thinner bone structures. Therefore, denser structures require more radiation to be adequately imaged. Question 23. A patient's panoramic radiograph shows a distinct, uniform radiopacity, light area, across the entire image that obscures anatomical structures. The most likely cause of this error is: A. The patient was wearing earrings during the exposure. B. The lead apron was placed too high on the patient's neck. C. The patient's tongue was not in contact with the palate. D. The exposure settings were too low for the patient's bone density. Answer: B. The lead apron was placed too high on the patient's neck. This question assesses knowledge of common panoramic errors. A distinct, uniform radiopacity across the entire image that obscures anatomical structures is a classic sign of a lead apron artifact. If the lead apron is placed too high on the patient's neck, its radiopaque material will be positioned within the primary X-ray beam during the panoramic sweep, resulting in a large, unsharp, light area that blocks the diagnostic information. While earrings cause distinct, localized artifacts and the tongue not on the palate causes a dark radiolucent shadow, the widespread uniform radiopacity points directly to the lead apron being incorrectly positioned. Question 24. What is the main purpose of using a thyroid collar during dental radiography? A. To prevent motion artifacts during exposure. B. To reduce exposure to the radiosensitive thyroid gland. C. To provide comfort for the patient during the procedure. D. To protect the patient's reproductive organs from scatter radiation. Answer: B. To reduce exposure to the radiosensitive thyroid gland. This question focuses on a specific radiation protection device. The main purpose of the thyroid collar is explicitly to shield the thyroid gland, which is particularly radiosensitive, especially in children and young adults. While a lead apron covers reproductive organs, the thyroid collar specifically targets the thyroid. Reducing exposure to this gland is a key component of the ALARA principle to minimize the risk of radiation-induced thyroid conditions. Question 25. An unexposed dental film is accidentally exposed to white light before processing. What will be the appearance of this film after it has been correctly processed? A. It will appear completely clear. B. It will appear completely black. C. It will appear fogged with reduced contrast. D. It will appear normal, as white light does not affect latent images. Answer: B. It will appear completely black. This question tests understanding of how film emulsion reacts to light. Radiographic film is designed to be highly sensitive to light, not just X-rays. If an unexposed dental film is accidentally exposed to white light, the silver halide crystals in the emulsion will react just as they would to X-rays. When this light-exposed film is then correctly processed, the developer will reduce all the sensitized silver halide crystals, resulting in a completely black film because all areas have been exposed and developed. This is why film must be handled only in a darkroom with safe light conditions or kept in its light-proof packet until exposure.